My name is Erin Colburn. I'm the Pre-Health Advising Coordinator for the College of Health Science at Boise State University. I'm very excited, and it is a great pleasure to introduce Ken Turley from Harding University. He's going to talk about a program in cardiac function and interventional therapy, a master's degree program at their institution. And I'm going to give the time to him.
So thank you all for meeting with us. So my name is Ken Turley, and like Erin said, I'm from Harding University. It's in Arkansas, so I don't know if you've been to Arkansas, but it's a beautiful state. I hope someday you'll come visit if it's for the program. But so we're excited to share about a new program we have. It's a master's in cardiac function and interventional technology. So before I get into the program, I kind of want to get into a little bit about why we think it's important to develop this program. And so some things that I think a lot of you probably know. If you look at in the United States, the leading cause of this cardiovascular disease. If you look at the CDC data and American Heart data, it's estimated that around 25% of Americans die of cardiovascular disease, costing our country around $220 billion plus. It's American Heart data. Again, I think you probably learned in your classes that it's not only a problem in our country, but even globally, it's a problem. If you look at the World Health Organization data, they would tell you that cardiovascular disease is also the cause of death worldwide. So it's estimated to be around 18 million deaths a year. That's around 32% of deaths. Now, in some countries, others are the primary cause of death, but globally, cardiovascular is the biggest cause of death in the world. So if you look at really what causes and both morbidity and mortality, but what primarily is responsible for the majority of these cardiovascular deaths, it's some sudden change in cardiac. And one of the main disorders that we talk about is sudden cardiac death, which is just a fatal change in cardiac rhythm of some sort, reported to be responsible for up to 4,000 cardiovascular deaths a year. So this sudden change in cardiac rhythm, which makes it around responsible for 60% of deaths in the United States each year. So the majority of their death are some electrical disorder. Another real prominent electrical disorder that's a problem in our country and really worldwide is AFib. You may know someone with AFib. Estimated, if you look at the Framingham data, around 1 in 5 Americans by the time they're 65 will have AFib. And if in 2018, it was listed around 176,000 death certificates and was listed underlying cause of death in around 20,000 of those cases. So these electrical disorders are a major contributor to cardiovascular, which is a primary killer in our country. And that really has led to an area of clinical work. Two different areas. One's called cardiac rhythm management, and the other is electrophysiology. And so these are areas of clinical expertise where people use for two different areas. One is cardiac management. We see here a pacemaker, and so cardiac rhythm management is individuals are trained or use pacemakers and ICDs, implant cardiac defibrillators, to manage and potentially prevent fatal disorders. A newer area is electrophysiology, and a really growing area now. And this is an area where we can do anatomical of hearts. And so if we look over here, and if I was live with you, I'd ask to identify. This is actually a chamber in the heart. And if you can, any guesses on what chamber that is?
All right, we're gonna go back to our point and try to share a little bit of information about the slides Ken's sharing with us.
Okay, good deal. So these are the two different areas that we're training in. So cardiac rhythm management and electrophysiology. So cardiac rhythm management is pacemakers, defibrillators, and other implantable electronic devices. And on the electrophysiology side, that's pictured, Ken's highlighting it with his cursor. We can see that, Ken, thank you. That's a three-dimensional map that has been built by a catheter placed up inside the heart. There was nothing there, just a blank canvas before, but as the physician moves that catheter around, it builds this three-dimensional model that kind of looks like it came from a CT, or if anyone is familiar with engineering, kind of like an AutoCAD design, but this is kind of a model of the left atrium. You have the 4 pulmonary veins coming out from the back wall there. This is a posterior view. That green catheter there is in the esophagus. It's right behind. They're monitoring the esophagus when they do this procedure. And that purple color that you see everything in, that's healthy tissue. The red dots are where they've burned lesions. And so atrial fibrillation is one of the few rhythms that they ablate that's not a macro or micro reentrant circuit or a focal arrhythmia. So the 4 pulmonary veins are all triggers for patients in AFib. And so the physician has basically burned little lesions all the way around each ostium of each vein. And this is to prevent patients from going into AFib. And so there's the lowest success rate out of any procedures that they do in ablation has to do with AFib ablation. And it's about 70 to 80% successful after the first try. But most other arrhythmias that they ablate, atrial flutter, reentrant tachycardias, focal tachycardias, are usually 90 plus to 100% successful. So that's pretty cool. There are tasks that the industry representatives have to perform. The physician is moving the catheter in the heart. You are helping build that map there. And so you can move on to the next slide. So how big is the market? This market is growing kind of on a parabolic curve pretty much. So the US market is forecasted to be 18 billion, was reported to be 18 billion last year, and up to 23 billion by 2025. And if you go on to the next slide, you'll see that the worldwide market, because the US has kind of the most market penetration for a lot of these therapies, and a lot of the rest of the rest of the second and third world is kind of unreached for a lot of these therapies. You have a forecast worldwide market of almost 70 billion in just 3 years from now. So moving on to the next slide, global industry. These are a list of the companies, and many of these companies, you have Abbott, and then next to it you see CRM, EP, structural heart. We could add additional ones to that. So Abbott is a large medical device manufacturer, but they have multiple divisions, even just within the cardiac device space. So they have a whole division, corporate division, focused on pacemakers and defibrillators, and they have a separate corporate entity just focused on electrophysiology, mapping, and ablation. They have a separate entity for structural heart. They have a separate entity for coronary interventions and a separate one for peripheral. So these are kind of 5 separate large micro companies within one large company that could be a potential employer. So just kind of shedding a little bit of light on the potential need out there and the employers. So moving on to the next slide, current CRM and EP training, there are no other degreed options out there. That's kind of what's unique about this program. There's always been a need of well-trained employees in this field. And historically, the way to get into this field was a indirect path. They hired nurses, surgical techs, PAs, with years of cardiac experience into these roles. And there's not enough great experienced people left for them to hire. So they've supplemented that by hiring a lot of people from 3 different post-baccalaureate, but just certificate programs. It's ATI Prep MD and the EP program in Houston. So these programs are collectively training and graduating around 150 students per year. all with the high 90 to close to 100% placement rate. And let's see. And those are the only kind of direct career pathway options into this space besides us. So our program is going to be the first master's degree option to jump into this industry. So our mission is to instill graduates with the knowledge, skills, and dispositions for successful careers in servant leadership and cardiac device interventional technologies, with an emphasis in cardiac rhythm management and electrophysiology. So this is going to be a very intense 2-semester master's degree program. It's a cohort program, so you are moving through this program with one group of students and then you graduate. That's a lot of fun because you're all starting your careers at the same time afterwards, sometimes even with the same employer. And so you have a network of fellow students and graduates of this program that you know already out there in the industry. The prerequisites are bachelor's degree, 3.0 GPA, GRE, in anatomy and physiology 1 and 2, 8 hours of anatomy and physiology. So that's not freshman or elective level, but sophomore or junior level, what health sciences would qualify for. And then next slide, Ken. Kind of how this went about and happened. This gentleman up top here, Mark Sweesey, he was the founder of the first certificate program that started back in the late 80s down in Florida. And then in the late 90s, it moved to Greenville, South Carolina. This was the only program in existence that trained post college graduates to work in this field, and had, I want to say, out of 33 years, over 800 graduates, there were 7 that didn't get jobs. I kind of know those statistics because I worked there with Mark. I was a student there 15 years ago, worked in the industry for 9 years, and then went back to ATI to teach for 5. Mark Sweesey retired a few years ago, and Ken was talking to some exercise science graduates that had gone through ATI's program, and they were all loving their careers. They were all in different areas in this industry, and mentioned to Ken, hey, this is great. We recommend as many of your students that have an interest in pursuing this. It's just a wonderful career. So Ken started thinking about, why not Harding start a program like this, or could Harding start a program like this? And he went to ATI for a short program geared for healthcare professionals. That's where we met, and he spoke with Mark, and just that's kind of magic happened, and now we're starting a master's degree program. So next slide, Ken. This gets into the coursework a little bit, and there are, each semester, fall semester and spring, there are 5 classes that mirror each other. So you have a class, Cardiac Function 1 in the fall, Cardiac Function 2 in the spring, a class for CRM and EP, Cardiac Applications Lab, Cardiac Interventional Procedures, and then we have a class focused on career applications. What Ken is playing in the bottom here, he had the opportunity to go up to Minnesota. The University of Minnesota has what's called the Visual Heart. Is it called the Visual Heart?
Visible.
The Visible Heart Lab. It is a library of over 600, I believe, hearts that usually come from transplant patients, patients that donate their organs for transplant, but the organs are too sick for transplant. And so their hearts are explanted. If they receive them soon enough, they can hook them up to oxygenated fluid, and the hearts can beat for several hours on their own. Physicians can then put cameras in and visualize things and actually practice performing procedures on them when the hearts will no longer beat after a few hours, they put them in a jar, and then you have over 600 hearts with all these various anatomies and cardiomyopathies that physicians from around the world can study, and it's open public source data. So that was a heart beating on its own on the left, but on the right, what Ken is playing now is this is a camera footage from inside a beating heart from the Visible Heart Lab, where they're putting a leadless pacemaker in the heart. So one of the fun things in our cardiac function class that we're going to be able to do is probably 3 pig heart dissections, but also we have access to a cadaver lab for the fall semester, and our students will be doing cardiac cadaver dissection. So they're doing a tug test there. What's unique about this particular device they're implanting is that it's a leadless pacemaker. Most pacemakers are under the skin up in the upper left chest, and they're just under the skin with leads that go, which are wires that go into the subclavian vein, go down to the right side of the heart, right atrium, right ventricle. And those leads are considered to be the weak link in the system. The wires fail over time. So this is a pacemaker that's kind of the size of a quarter, that's placed in the ventricle in and of itself. So it will last about 10 years. So it's pretty new technology and pretty cool and an amazing advancement in this field. So moving on to the rest of the slide, Ken. We're going to have a lot of training in ECG interpretation and other technologies, left atrial appendage closure devices, left ventricular assist devices. So LVADs are pumps that basically are bridged to transplant. Impella heart is another hemodynamic device. TAVR stands for transaortic valve, transcatheter aortic valve replacement. So what they're doing, and this is, you may recall on the company slide where they had all those divisions, there were several companies that had something called structural heart. Basically, companies are able to do now minimally invasively with a puncture, go in with catheters and do procedures that used to be open heart procedures where they would do a sternotomy and have the heart exposed and the patient on bypass. So aortic valve replacements, mitral valve modification, very soon tricuspid valve, left atrial appendage closure. These all fall into that structural heart category, and it's all very cutting edge, and we'll be spending a lot of time on that as well. Moving on to the next slide. If I haven't bored you to death so far, you're probably wondering about, hey, this sounds great. This sounds very specialized. Why do this? Why should I have any interest doing this? And what am I going to be able to do? So if I could boil it down very simply, medical device reps in this field, what's unique about working in this field is that as a cardiac device representative, there are tasks in the procedure that you actually have to perform in order for the physician to be able to do the procedure. And this is usually done in tandem. As the physician is working, you are working. And what you do and how well you do your job impacts how well the physician can do his or her job. And that is really crazy to go through a program in a year and be out there and you're really assisting heart surgery. But it's done all the time for, as long as this industry's been around. And that's why there's the need for such specialized training. So the industry companies are thrilled to have this as an opportunity, because those students from the certificate programs or the nurses, techs and PAs that they hire with years of experience, they still have to do a 1 to 2 year training program, kind of apprenticeship, when they go to work for these companies. Our own students and graduates will probably have close to a 6 month to a year training program to complete. But at the end of it, you're in a role working in conjunction with the physician. And at the end of the procedure, there's just whenever you hopefully you're having nothing but positive outcomes, there's just a great sense of pride that you're making a huge difference. And a lot of these procedures can actually be curative of these conditions for these patients. So these are all on the left, different sort of types of technologies you could work with. But over on the right, these different types of jobs, these are different roles. These are titles. And you have each of these titles on the right in those fields, technology fields on the left. Most students that pursue an industry path will be clinical reps, which means your primary responsibility is covering the procedures and making sure the physician and patients have the best outcomes possible. That's your job. Is just go in there, do the best job possible, make sure the patient has a great outcome. Market development is more of a community awareness, sort of kind of a public health awareness side to that. There's a lot of kind of marketing involved with that students could choose to get in down the road. All of the next few jobs are usually promotional opportunities out of being a clinical rep. Sales rep, you can pursue the sales rep role if you want, which does mean there is more selling to it. Clinical educator, you can be in charge of training physicians in new technology, training employees in new technology, training healthcare professionals in new technology. Clinical engineer are individuals that have responsibilities working with pre and post FDA approval devices. So if a device is not FDA approved yet, you have these clinical engineers that just work with those specialty devices that are being researched. But the clinical rep role at the top is sort of can be a terminal career position. You have nurses and techs that work for many years and end up as a clinical rep later on in their career, and you can stay and move up in seniority and get to the point where you're making income reliably in the mid 100s there. So the benefits, let's get to that. I mean, the main benefit that's important is you're impacting patients' lives, but these positions start out the first year making 65 to 95, and that's where you start. And so it gets significantly north of that. And it definitely gets significantly north of that if you take any of these promotional opportunities down the road. The unique thing about having a master's degree in this field is that most management roles, whether you pursue an industry option or an institutional option working at a hospital, most management positions require you to have a master's degree. And this is providing that to you right out of the gate. So with that said, next slide wraps it up, and we're happy to answer any questions.
Does anybody have any questions?
I didn't quite get a sense of like, I mean, I kind of know like if somebody's a respiratory care therapist or nurse or whatever it might be in an acute care setting, they're typically working anywhere ranging between 8 or 12-hour shifts, three times a week, that kind of thing. What are we looking at in terms of employment when you're on the job?
Sure. That's a great question. It's very dynamic. So you're usually on a team, and I would say the average work week as a clinical specialist is between 40 to 60 hours. And depending on the technology you're working with, for example, EP, mapping and ablation, all of those procedures are elective. None of them are emergent. And so you typically know tomorrow what your hours are going to be. However, on the CRM side, pacemakers and defibrillators, you can always be 4 o'clock on your way home and a patient shows up in the ER an hour away that you have to go drive to go take care of that. Or a patient comes into the ER at 9 o'clock at night and complete heart block, and the physician really wants to do the procedure at 10 o'clock. And that doesn't happen super commonly, but it can. So I know I'm not really directly answering your question, so it just varies. But I would say 40 to 60 hours is a good um, good idea.
There's
Natalie-
also the remote monitoring. Tristan, tell me about remote monitoring.
Yes,
That's kind of a lot different for WISE.
so what Ken's referring to, pacemakers and defibrillators all store a lot of diagnostic data, and the newer devices actually can send that via your cell phone to a website daily. And so there's all this data going to the website, and they need people to review that data. And so there are, for people, and this happens all the time, say, individual gets married, they have kids, they need a better quality of life, and the unreliable time or work days just doesn't work for them. They can go work for either a remote monitoring company or a hospital or a outpatient office and have more reliable hours.
So Tristan, I have a couple questions for you and Ken. I'm
Sure.
Natalie. I'm the program director for our interventional cardiology program at BSU, which is
Awesome.
a bachelor's level program. I am curious, you said that your audience was students with a bachelor's degree. They had a prereq of a year of A&P. What bachelor's degrees would you accept? And is there a patient care experience requirement?
That's a great question. So we do not have a patient care experience requirement yet. The bachelor's degree requirements, we do not have any besides those A and P classes. However, it is definitely beneficial to have more of a health sciences background. Student applicants that we've received so far have been pre-med, pre-PT, exercise science, health science, chemistry, biology. Mostly that we have had nursing. We had a young lady that was nursing switch to business. With the 8-hour requirements, it'll be difficult, not impossible, but difficult for somebody to just go get a marketing degree and qualify for those upper level A&P classes. The other programs, and this may be a bit of a shocker, but the other certificate-based programs actually have they do not have the A&P requirements or the degree requirements at all. So you can be a history major and after 6 months, help heart surgery.
Biomedical, okay.
Sorry, I had a couple more questions, if that's okay. It sounds like you have some pretty impressive clinical experiences planned. Is there a clinical rotation involved, or is there just a series of clinical experiences?
There's not a rotation point in that. At this point, at a certain point, classes will cease, and then it's all clinicals after that. So there's going to be clinical days, whole days of clinical rotations mixed into the fall semester, but even more so in the spring semester. So about 1/3 of the clinical rotations will be in the fall at the end of the semester, and two-thirds of the clinical of the rest of the clinicals will be in the spring, kind of interspersed throughout. And for every day of clinical exposure, there's probably gonna be 2 days of simulated hands-on lab experience in person.
Did you partner with any particular with industry leader in order to get access to mapping software, and how is this working?
Yes. So at ATI, we had 2 mapping systems. So we had they now have 3. So they had one Abbott system, they had 2 Biosense systems. So we do not have, when we're starting this program, we do not have a system, but just down the road in Little Rock, Abbott actually has a center of excellence with 5 mapping systems. And so they have numerous ice simulators there, recording systems, and a lot of equipment for us to use. So we are going to be purchasing this summer some simulators to have hands-on, and we're talking with the companies right now to see what can they leave us. They want to leave us something, but legally their hands are tied a little bit. But worst case scenario, Abbott has opened their center to us, and we can have our students there as much as possible.
Okay, and just for clarity so that I understand, the goal of the program is to graduate people who are going to work in industry. They're not going to be hospital employees scrubbing into procedures. Hence the reason why you can have people with no patient care experience. Okay, just checking.
Yes. They're the students will be able to take the RCES exam afterwards, they probably will not qualify for the RCIS. They may be able to if we extended the program a little bit, which we may be able to do in the future. But with the RCES, they will be able to scrub in EP procedures, depending on the state. But if they decide to pursue that.
Thank you.
But we think that'll be the minority, more than likely because of the compensation.
And just explain the program industry based. So we currently have Medtronics programmers, biotronic programmers on campus. They are giving us a person. So we are going to have a lab set up that is programmers from companies too. So there's industry has already been on campus and will continue to work with us in training the students.
I have just a few questions. I was really interested in hearing what types of individuals pursue this type of career. Like, what are they detail oriented? Are they really not wanting to get in the blood and the guts? Should they be aware they're going to get in the blood and the guts? Kind of, can you give me an idea of who is attracted to this type of field?
Yes, so that can be very broad. However, if I may kind of select down to who tends to just excel really well. And so that will be first and foremost people that like to learn. And so the physicians we work with, electrophysiologists, after med school, they go through internal medicine, then they go through cardiology, sometimes a fellowship in internal interventional cardiology. Then they have their EP fellowship, and sometimes they tack on a year after that. So the youngest EPs that you will work with will probably be in their mid-30s, and they consider themselves to be physician scientists. There's a huge just culture of learning and research. You may begin to hear my daughter in the background. So learning, constant learning for the rest of your career. And so for some people that might be discouraging, but it's a lot of fun for those people. And then problem solving. Many, especially on the on the implantable device side, on the pacemaker and defibrillator side, 90+% of the time, thankfully, these devices function very normally. However, that is usually not what you spend the bulk of your time addressing. Usually you're spending a lot of your time outside of procedures, working with the patients whose devices are working or functioning abnormally. Patients are having new rhythms and the device is not responding. Things need to be diagnosed, and you need to determine a solution. So, and then on the mapping side, each patient is kind of a new puzzle. You go in there to study the electrical conduction and to find where the reentrant circuit is. You may have an idea, but a lot of times you go in there and you may have a guess to what the diagnosis is likely is, but then it turns into something completely different. So problem solving and team oriented. So there is, communication is big, working on a team is big. And so as soon as you feel like you've arrived and you know everything, you can be humbled. And so you definitely need to be a team player. So
okay.
Was that helpful at all?
Yep, no, that was exactly
Okay.
what I was looking
All right.
for. I
Okay,
have
great.
3 other questions, but I know Mary has one, so I want to give her a
Okay.
shot.
Sorry, Tristan, I may have missed this, but how long has the program been around?
So this is going to be its first year.
Okay, gotcha. So you don't have any data yet on job placement or success of your students getting out and getting jobs yet, which sounds like there's definitely a need. Is also these students, this would be their job, right? It sounds based on the intensity of the program, they wouldn't really have much time for another job. And I'm
Correct.
assuming that as well. And then is this fully on campus, or is it remote, hybrid?
So it's fully on campus. It's fully on campus, although the clinical sites will be off campus, but with this particular offering of the program, it's fully on campus.
So tell me, what's the worst thing about working in cardiac function and intervention therapy?
The worst thing,
Ken can answer too. Like, what's the worst thing?
yeah, I would say the worst thing are and this is really what drives the learning and the improvement are those patients that haunt you when something is out of your control that happens negatively, and going back through your mind, could I have done anything differently? Could I have predicted that? What were the warning signs? And so there's a lot of Monday morning quarterbacking that can happen. And for example, the local Abbott Center, one of the things that they'll do, because they have that mapping center as a resource, many difficult procedures, they will download that data, take it over to the office, put it up on their systems, and have all of their employees basically redo that procedure with the same data to see if anyone can come out with a better outcome. And so that can be the worst feeling when you make a mistake and miss something, and that's what drives the level of excellence to be what it is.
But I put that on the other end and say it's also the best thing in that impacting lives, and you have a direct impact on their lives and their health. And so you get to see that. So you kind of see both ends, I think, of that room.
Well, Ken, you just answered the second question, which was, what's the best thing about being in this industry? Good job. Where could a student look up more information? Not only just reaching out to you, obviously it's great to reach out to your program and get some more information, but what advice could you give to a student who wants to pursue something in this industry?
Yeah, one thing, so obviously they can look online. We have three of our most recent grads from Harding that I've worked with that have agreed to talk to students. They have talked to many students. And so if students are interested in talking to someone that's out there right now, have one in CRM, one in EP, and then one doing home monitoring. So kind of all spectrums within the area. And so that's one thing I would say is to, send me an email, send us an email, and we'll get you with people that are out there doing this right now. So I'd say that's my first thought. And then otherwise, we also have contacts. Oh, Tristan especially knows people kind of all over the country. And so there's a good chance we can get you in touch with someone or near there that can get you with someone that actually is out there in your area that you can maybe even shadow or for a little bit. So I think that's the way to learn.
Sorry, Tristan, you mentioned kiddos. I had a kiddo just ask me where his cleats are. All right. Does anybody have any other questions to add that they would like to ask?
I do, but I keep forgetting them. Sorry. So
Okay.
maybe I'll follow up with an email. There's a lot of information, so appreciate everything.
Yeah.
Well,
So that one thing I don't think that came up is program's 32,000. So it's a 10-month program. 2,000, and then you're done. And you asked about the job placement, and we don't know. No, we don't have that data. But if you look at ATI and PrepMD, they report 8% employment since the program started. And so just as an example, my most recent Harding student that went to ATI, my office about 3 months ago, he works for that CRM in Little Rock right now. On interview day at ATI, he had six offers that day. So, and I think that's pretty common. I don't know about six, but we can't guarantee you're going to get a job. But we had a BioSense rep the other day. He told our provost that he goes, I can't imagine that we could probably hire your whole first time off. And so that's just one person. So having a huge interest in the industry on campus already. So I can't imagine they would not have the opportunity to be employed, especially most of our kind of from the central part of the United States. If we get people from Idaho and from Wyoming, I'm from Wyoming. We actually had one from Wyoming. That's kind of cool. But you start placing them on the West Coast because everything else is on the East Coast. And so there's a great opportunity for people from your area. So
Great.
I think the opportunity is just endless almost.
Great. Well, I want to thank everybody for Ken and Tristan for coming and sharing about your program. Maybe next year you can come back and Zoom with us and tell us how the program went and share a little bit about that information. I always like to see after you've had a full year of classes and you can share, maybe even bring some students. That would be really cool. But nonetheless, I'm very thankful for the time. I think it'll be very informative for some of our students, and it will certainly help some of our students maybe think about, well, how can I use a kinesiology degree or a health studies degree and still kind of be a part of maybe some of the areas that they weren't thinking that could be possible. So this is really cool.
Oh, I have one more question. When is the application to apply?
But we're accepting applications now. We have 27 in the application pool. We've accepted 11. We're interviewing a couple more this week. So by the end of the week, we potentially could have 15 goal, but that doesn't mean that they'll all finish it out, accept either. So we'll have room for a handful more. So we're accepting them as we speak.
Great.
And online, you can go online. You can link to the application process.
Great. All right. I'm going to stop the recording.